Okay, the next one, we have here the hepatitis B. So hepatitis B is basically hepatna virus. So this is the only DNA na virus belonging in our hepatitis. So that one is a double-stranded DNA, and that one is an envelope na virus. Okay, so we have here, there are 8 genotypes belonging to your hepatitis B. So regarded as the genotype A to H. And the genotype A is the most prevalent in the US and worldwide. So basically, as to the structure of the virus, okay, that one. So we have here the nucleotides of that is made up of the double-stranded na DNA. Meron siyang envelope na antigen, and we have the surface antigen, which try to be found, pwede siyang free in the plasma or serum natin, then it's highly infectious. Okay, hepatitis B, considered to be the major cause of the morbidity and mortality, is the most common cause of your chronic hepatitis. Okay, the incubation period for that 45 to 90 days. And most likely, you get considered to be a chronic hepatitis B infection here if the infection tried to last for more than 6 months. Like for example, if you're still positive for the Hbs Igg na marker niya for more than 6 months, then you consider here to be a chronic hepatitis. The problem with a chronic hepatitis is it could eventually result to your hepatocellular carcinoma or liver cancer. And another one is it could also result to your liver cirrhosis. The problem with the hepatitis B, most of the patient, once get infected by this one, they will not able to recover. Most likely, 99% of that population infected by this one will not able to recover. 1% lang maka-recover, but most likely hindi. As to the mode of transmission, so you get infected here by the hepatitis B the same way as when we are infected by the HIV. So number 1, you could get infected by hepatitis B by sexual. So it could be anal, could be vaginal, or even by exchange of the body fluids like seminal fluid, vaginal fluid, saliva, provided ang saliva natin ay may blood. Another way is your parenteral. Parenteral, like your needle stick puncture, your blood transfusion, or even by your IV user sharing among drug addicts. And lastly, you get infected also by hepatitis B by perinatal, so mother-to-child vertical transmission. Okay, now we go to different markers with your hepatitis B. So, ang rule natin for the markers would be the first in will be the last out. So, the first in, kung sino unang nag-appear, will be the last to disappear. So, this is the order of the appearance of your markers. The first to appear, we have your Hbs Aggs, stand here for the surface. So, this is the marker that usually detected here after 2 to 10 weeks after the infection. And it might be also undetectable here after 4 to 6 months after the onset of the clinical symptoms. So, Hbs Agg ay itong marker natin for number 1 is a marker for active infection, the marker for initial infection, and this is also the marker where it's being detected or being tested for our blood donors in the blood bank. And again, this is the marker once your test result for this one is positive for more than 6 months, then you consider someone to be having a chronic hepatitis infection. The second marker, we have your E Antigen. So this is your envelope antigen. So this antigen marker appears shortly after the appearance of this one. So pag nag-appear ito, afterwards, ito na mag-appear. So this is the marker for your viral replication. Okay, and basically this is the marker for your infectivity. Pag sinabi infectivity, then we consider this one as a marker for highly infective ang patient natin, highly infectious ang patient natin. So this one, pag na-positive ang patient dito, pag bago pa lang sakit, still ang patient positive pa din dito. Positive dito, still, okay, positive dito, positive pa din dito. And then again, this is the marker for your, again, infectivity and the marker for the vertical transmission. So the vertical transmission is a marker for mother-to-child transmission. The next marker we have here, the core antigen. The core antigen most likely is not detected in the serum or plasma of the patient. It's because here, again, this is the marker that is being masked by the envelope antigen. So, hindi ito diagnostic, hindi natin minimeasure ito. Then after that one, as the disease try to progress here, then the patient try to develop an antibody. So next, we have the patient develop here anti-Hbc IgM antibody. So this is the first antibody to be produced. This is the antibody produced here for an acute infection. And most likely, this is also an antibody here that usually present if the patient, we are suspecting the patient to be positive. Kasi ito may tendency ang patient natin na mag-negative dito. So dapat pag nag-screen tayo ng donor sa blood bank, dalawa sila ang siniscreen natin. Like, kung nag-negative siya dito, positive siya dito, then still consider pa din na infected ang ating patient. Again, this is a marker for your acute infection. Okay, another one, we have here your, usually this one try to persist 4 to 6 months. Again, this is a marker that try to appear after 1 to 2 weeks after the appearance of your Hbs Igg and try to persist for 4 to 6 months. The next marker produced here, Anti-Hbc Igg. Again, this is the marker for lifelong marker and the marker for your chronic hepatitis B infection. Again, this is the marker that would identify if the patient's been chronic infection. It's a lifelong marker. What do you mean by lifelong markers? So once the patient got infected by this hepatitis B, so kahit naka-recover ng patient, still magpa-positive pa din ito, signifying that the patient has been infected in the past. The next marker, we have your anti-HBe. So this is the marker na ma-produce pag ito ay nawala. So, pag nag-disappear itong antigen natin, then the patient tried to develop here the antibody, anti-HBe antibody. Okay, again, the anti-HBe antibody is a marker for convalescence, the marker for the recovery. Again, if you have this antibody, then meaning to say the patient's about to recover, the patient's about then to is less infectious already. And lastly, we have anti-Hbs. Again, this is the marker that is being produced if the patient will have a negative result for this one. That will be, pag nag-disappear ito, that will be replaced by the antibody anti-Hbs. This is the marker for immunity. Pag sinabi immunity, it could be the marker for our, pag sinabi immunity, you will not get infected if you have already this one. Okay, it's a marker for our past infection or the marker for our vaccination. Like for example, if the patient is positive for this one, nag-positive siya dito, then the patient natin, our interpretation for that is the patient natin would have already recovered from the infection and the patient has already been infected in the past pero naka-recover na siya ngayon. Like for example, pag itong marker natin, negative lahat, ito lang positive, so that will mean the patient has this antibody marker because the patient has undergone vaccination. So once you have this antibody, you will no longer able to be infected. In our PowerPoint, we have the table for that, some other results here, like for example, HBs Igg negative, total anti-HBC negative, anti-HBs negative. So negative lahat. Then we consider someone to be susceptible. Pag sinabing susceptible, then a patient is still susceptible, has a tendency to get infected pa din if okay, ma-infect siya or ma-expose siya sa virus natin kasi lahat ng markers are all negative. The second one, we have HBs Igg negative, total anti-HBC positive, anti-HBs is positive, so that's a past infection. Okay, kaninang example natin, di ba, nag-positive siya anti-HBs, positive sa total anti-HBC, so past infection ito. Pero pag ang positive natin lang ay anti-HBs, negative and HBs Igg, total anti-HBs negative, anti-HBs, ang positive siya lang positive, so that will signify immunity due to your vaccination. And HBs Igg positive, total anti-HBC positive, IgM anti-HBC positive, that's acute infection. Okay, pero pag IgG ang positive natin, that's chronic infection. Your total anti-HBC is equivalent to your anti-HBC IgG antibody. So, pero pag ang positive lang natin is your total anti-Hbc IgG lang, sa gitna lang. So, we have so much interpretation for that. Okay, like for example, kung ito lang positive natin, so it might be nasa gitna na ito. Madaming interpretation for that. Number one, okay, so pwedeng chronic infection. Second one is the patient about to recover. Okay, or the patient is a carrier. So, kung ito lang marker ninyo na positive lang siya dito, okay, so we could consider someone to be carrier. Low level. Okay, the patient would have here positive lang for that, like IgG, and the Hbc IgG. So, we consider that one as a low level carrier ang ating patient. Okay, we have here the method for determination of your markers. You could have here your, okay, for the antibody detection, you could have your, okay, we have that one, target amplification, branch DNA signal amplification, real-time PCR. Again, the real-time PCR will be very sensitive and very specific for that. It could get a positive result here even 21 days prior to the appearance of your markers. Okay, we have preventive measures. Okay, so we are screening the donors for in the blood bank for possible transmission of this one because it's also bloodborne. For the vaccines, our antigen here for the vaccines may be number one, inactivated the virus. So coming from hepatitis B virus infected na patients, or your bibigay mo sa patient as your vaccine may be a recombinant na antigen from genetic engineering na yeast. So you can also use that one to simulate antibody production. So the vaccine is being given for infant. So after birth, ito ang one of the vaccines that should be given to the patients. Another one should be given for high-risk individuals, mga healthcare personnel, or even for you when before you go in your internship. And multiple sexual partners, homosexual partners. We could also give here your HB, okay, your HBIG. Okay, your HBIG is your Hepatitis B Immunoglobulin. So basically, this is a passive antibody. It's being given for those patients. Pwede mo ito maibigay sa patient pag na-expose ang patient as a passive antibody transfer to neutralize the virus. So pwede siya like na-infect ang patient ngayon pa lang siya natusok. So pwede mo siya bigyan nito. But then again, never give a patient with a vaccine pag positive na siya. Why? It's because na pag positive ng patient, di ba may virus na siya. Pag nabigay ka pa ng vaccine, since ang vaccine natin ay virus na siya, so dadagdagan mo lang ang virus. And this one will not also effective pag matagal na ang hepatitis B ni patient. Okay, we have here the manifestation. So, 90% of populations would be asymptomatic for the hepatitis B. Pag hindi siya nag-jaundice ang patient natin, most likely that's for hepatitis B. Pero pag nag-yellowish ang patient natin, sobrang nilaw niya, then most likely that one is hepatitis A. But for the hepatitis B, asymptomatic ang patients. Okay, we have here the manifestation of hepatitis B. So 90% are symptomatic. Again, so majority don't have here yellowish manifestation. So we could also have here acute hepatitis. Ito yung mga may yellowish manifestation. So 5 to 15% of less than 1 to 5 years old. 30 to 50% adult patients would have the yellowish manifestation. Okay, pero pag may yellowish manifestation ng patient, then we consider that one as severe na ang kanyang damage. Because most likely, pag wala pa asymptomatic ang hepatitis B natin. Pag nag-yellowish na siya, so sobrang severe na manifestation. Then we have here HBs Igg for more than 6 months, positive pa din siya. Then we consider someone as chronic hepatitis. Again, a fear of chronic hepatitis could result to your liver damage, liver carcinoma, okay, liver cirrhosis, and hepatocellular carcinoma.